had the pleasure of interviewing Dr. Ian Tong, Clinical Assistant Professor at Stanford University Medical School, as well as the Chief Medical Officer at Doctor on Demand, a telemed application that allows people instant and affordable access to a board-certified doctor. I want to thank you so much, Dr. Tong, for your time. If you could please share with us your backstory.
Well, hi, Jilea, and thank you so much for having me and doing this interview. My background is that I was originally born in Oakland. I got to grow up there and in the Central Valley of California. I attended undergraduate at the University of California, Berkeley. And from there, I then went to medical school at the University of Chicago. So left my home state to see a new city and a new state. But got to come back for my internal medicine residency training at Stanford, and I got to be a chief resident of the residency program there. And that's where I really got this peek behind the scenes of what it takes to really train and prepare a professional for being an independent practicing physician. Really fascinated by that. I loved medical education. And so I decided to join the faculty, or at least I should say I was invited to join the faculty and was very honored to be invited to do that. And so I spent the next 10 or so years getting my start at Stanford and the VA Palo Alto, where I took care of homeless veterans and rural veterans as the medical director of Veterans Outreach. And so learned a pretty good amount there about what it takes to run a practice, develop a program, and then really engage patients through that program remotely. I actually did a little bit of telemedicine at the VA, got a very good introduction there. And then the last 5 years I spent as either medical director and now chief medical officer at Doctor on Demand.
What are your biggest accomplishments?
Well, I always answer this question about accomplishments with my family, because that's where it begins. I have 3 beautiful little children who keep me energized and are very active. I also was fortunate enough to meet my wife in medical school, and so we really have built a life together. We both have very active professional careers as physician executives, and so that has to be number one, and that is an ongoing effort and a masterpiece, hopefully in the making. But the other I think really great work accomplishment, or thing that really just gets me excited right now, is the work that I'm doing at Doctor on Demand. I and my colleagues have been able to build a national medical practice that's really a virtual care practice in the effort of improving access to high quality care. So what that means is we're using technology and allowing patients to connect to a doctor from a mobile device, and to really do that without compromising excellent care, without compromising the connection in the doctor-patient relationship. So that is very difficult to do, because technology at times can get in the way, but we've been able to build a very strong platform that takes the technology, removes that from the equation as much as possible, at least in the experience side. And so doctors and patients can make the connection, get to know one another, build a relationship, and patients can actually have outstanding access in the care that they receive.
Great. Can you share the funniest or most interesting story that's happened since you began leading your company?
The funniest thing that happened since I've been leading the company. I don't know, on the very first day of our of launching our practice, I actually got to do something that most doctors do not get to do, which is I was able to have my white coat on the top half of my body, but I was actually able to wear shorts and sandals on the bottom half, and that's not something that you get to do in the clinic, and get away with that. But no, we've had some really outstanding. I think one of the most interesting things that just happened to me recently was I had a patient who was an octogenarian, so over 80 years of age, with multiple chronic conditions, who was actually able to use our service, get on the service, And I did not believe her that she actually was 80. So hopefully I wasn't discriminating against her by age there. But I was just very impressed that she was able to navigate the platform, get on, and had multiple medications and so on that we were able to address. But so since I didn't believe her, she showed me her ID, and then she said, "Oh, hang on, it's probably my wig." And then she took off her wig and showed me, and I was like, "Oh, it was quite the moment." But I wasn't expecting her to do that, and that was a pretty funny moment.
That's hilarious. What do you think makes your company stand out, and can you share a story?
Yeah, I think there are multiple things. I really think that we have leveraged technology in a very convenient way for the patient. So convenience is one very big differentiator. And I do think that that's important, but I don't want to overplay just the convenience part. But right, being able to have on-demand access to a doctor and connect within a 5-minute average wait time, that's pretty amazing to get to do, and it's convenient. But I really like to focus on the access part. I've worked on issues around access my entire career, and what we're doing at Doctor on Demand is we're really improving access for the patient and for the doctor. We're giving them a portal that connects them over distance using technology in a really unique way. And what we've seen is that does not compromise the doctor-patient relationship. We're seeing that patients feel the doctors are spending enough time with them. The doctors are listening to them carefully. And we survey the patients to ask them about this. And so we've really been able to, to really see doctor-patient relationships develop and thrive on this platform. And then we do a number of quality metrics as well. And I think that's one other thing that people may miss is you don't always associate convenience or access to something as being high quality. You might think that you're making a compromise for the convenience and access. You may have to compromise a bit on quality or security, but that's not the case. Healthcare has a pretty high bar. It's a very regulated field. And we've been able to really show where we can provide this high level of quality without compromising on the outcomes.
Are you working on any new and exciting projects right now?
Yeah, the most exciting project that we have been working on. So based on what I had said before about improved access and quality, and the fact that we're able to do this at a lower cost than you generally see in an in-office practice, we've been able to begin developing more futuristic health plan designs. So designs that put virtual care at the center and really as the front door of healthcare, letting that patient engage care in a very patient-centered way, and having a delightful experience through technology with a great doctor, and then using that as the front door that then links them to the subspecialty care or to the pharmacy or to the laboratory. But all of that begins with a virtual relationship and a virtual experience, and then going to those more traditional outlets for care that you enjoy. So it ends up being an efficient model. It ends up being cost effective. And again, as long as you're focusing on quality, you don't have to compromise those quality pieces. So it's been very exciting, and I hope we can continue to go farther with that program.
That sounds great. What advice would you give to C-suite executives who are trying to help their employees thrive?
Well, I would give the same advice that I give many of my medical students and resident trainees at Stanford, which is it's a little of an analogy or analogous situation, but you never just want to go into the patient's room when you need to ask them a question, or you need to run a test, or you need them to sign a consent form so that you can get the study done and move things along. And I think the same goes for your employees. They are people, they need your support, and you should walk up to them once in a while, check in with them, and have it solely be about their agenda. Ask them how they're doing. Is there anything that you can do to help them? And some of them, I think you'll blow them away because they'll say, oh my gosh, that never happens. But I think it is a really important relationship building technique. And as long as it's genuine, you will have an employee that will be, I think, loyal to you, productive, and will feel, unfortunately, but will feel like they're in a very unique place. I wish this would happen in more workplaces, but I think if we do this, we will see employees that are just happy to perform and know that they're working in a very unique place where their leadership cares about them. And so they will do anything that they can to make that relationship work and make that work quality product high.
Absolutely. None of us are able to achieve success without some help along the way. Is there a particular person that you're really grateful towards that helped you to get to where you are today?
Well, I'm going to thank my wife for that, because she has inspired me through medical school. She's inspired me through residency training, and then as a professional in our careers, and then also as a parent. And so absolutely, she has been the overwhelming, partner and co-lead on the Ian Tong project for a long time. So she deserves all of that credit. And I always talk to students, Stanford really wasn't that interested in me. They were much more interested in her, and they kind of let me tag along. They eventually made me chief resident, but there's no doubt about it that the only reason that they interviewed me was because they really wanted my wife to be at Stanford. And I'm happy to admit that. That is true.
Funny. How have you used your success to bring goodness to the world?
Oh, that's a great question. When you're an educator, you have the opportunity to work with young people. You have the opportunity to develop the careers of young physicians. I think, if anything, that is the work that I never felt like the time there was ever idle or wasted, or any extra effort that I invested into an individual student or trainee was not worth that time. There is no doubt about that we have a profession in which the general public places a high degree of trust, but also demand on our performance and our ability to put their interests sometimes in front of our own to make sure that we do the best that we can for our patients. And so I feel that I've done my best to instill that in my trainees and my students. And if they've been able to absorb some of that, then I'll count that as good work.
Can you share the top 5 ways that technology is changing the experience of going to the doctor?
Yeah. Well, I think that there's 5. Okay, so I'll have to see if I can come up with 5. But there's definitely I think the experience is quite a bit different. So, one, let's just take a typical doctor-patient experience, which usually begins with the patient having to make some early compromises of their time and organization to even make it into the doctor's office. So there I'll say we've sort of eliminated the 3-week wait. I think technology can do that, and specifically we've been able to do that in our practice. There's also the discomfort or inconvenience of sitting in a waiting room. So that doesn't feel good to a patient, especially when you traveled through traffic and had to fight for your parking space, and then you try to go into the office and your blood pressure is high and you're sweating and you try to get in there. So I think that's another one. I think that the elimination of the waiting room is a good thing if we can do that, and maybe even bring back the house call reinvented, so that your doctor is there in your environment as the patient, where you're comfortable in your home. So I think we've been able to make an impact there. So we have the on-demand aspect. We have the fact that you do not have to leave your home or sit in a waiting room. We've also been able to through technology, bring great doctors to multiple areas of the country where they would not otherwise be able to travel. So instead of doctors having to make that trip or have an outreach to a clinic, they can now do that also from the comfort of their home. So now we've got the doctor feels more efficient. They feel that their experience is better but they also feel that their time is very purposeful because they're able to make that connection without doing the traveling themselves. So that's another. I think another one that we probably have really seen is doctors feeling that they're able to be very efficient. So we've talked a lot about the patient side of this equation, but But on the doctor side of the equation, it's efficient for them. Again, I mentioned the travel and time, but also they can see patient after patient in this model. So using technology, they are right there and they are connected. And then the final one that I would say is there's every few months there are new applications that are peripheral devices. I'll give an example, or Fitbits and Apple Watches, and I don't want to be too product specific here, but you name it. There are devices that begin to aid the physician in assessing the patient. And so there you have both patients thinking this is really great, they're getting high quality care, which is true. Then you also have the physician who says, I'm doing something in a way I've never done it before. So that's very innovative for the doctor. So I think on both sides of the relationship, technology is making it a whole new experience. It's bringing it at high quality in a way that it's never done before, high level of efficiency, and it really allows doctors to learn a new skill. And I think that is that's going to keep both people, hopefully both sides of that relationship will stay interested for a long time to come, because as I said, technology continues to roll out these aids to these types of virtual care visits every few months.
Can you please share your favorite life lesson quote?
Oh boy, I think probably has to come from one of the doctors that I respect the most, who's my dad, who said that his role as a doctor is to make sure that each one of his patients feels better when they walk away from him than they did when they walked up to him. And that sounds like a very simple equation, but actually it's not all that simple when you think about it. It really requires that you're on every day and present in the moment for each patient to be able to do that. I think it's a great lesson. It's a great challenge. I don't know that anyone is able to do it 100% of the time, but that's it's a good goal to have, though.
Some of the biggest names in business, VC funding, and sports and entertainment pay attention and watch and listen to our blog. Is there a person in the world or in the U.S. that you would love to have lunch with or breakfast with, and why?
Yeah, I think it probably has to be Melinda Gates for me. I think that the work that she and her husband, Bill Gates, have done through their foundation is outstanding. They have, they figured out ways to deliver some of the most essential healthcare interventions to some of the most needy people. And so when someone can do that, I think I just have a great deal of respect for it. And I'd really like to have that sit down, because I think that what we have done in Doctor on Demand is really a way to continue to improve that access. And so I'd love to see if there's ways that we can leverage what we do to continue to enable some of that work and bring high-level professionals as well to some of these communities would be fantastic.
Well, I would like to thank you so much, Dr. Tong, for your time. I encourage everyone to visit Doctors on Demand. And please, I believe your website is www.doctorsondemand.
Doctor, no S, yeah, doctorondemand.com.
www.doctorondemand. So please visit Doctor on Demand to learn more. But thank you again so much for your time.
Yeah, thank you for having me, Jilea. Appreciate it.